Find that with our very small approaches, we use an incision that's only about 6 centimeters long, it's hard for us both to see in the wound. So the challenge there is for him to be able to see the vessels while I do the dissection. The other issue, of course, is that L5S1 has a slope, and we need to crane our heads to look into the wound to be able to see. So in this case, we use the Modus V more for visualization than magnification. It allowed us both to see into the wound, but probably the most impressive thing was the fact that we didn't need to have our necks at unnatural angles for prolonged periods. We were able to stand up straight, look straight at the screen, and yet have that 30 or 40 degree angulation of the L5S1 disc accommodated by the angle of the Modus V. But obviously the big advantage was both of us, the vascular surgeon and I, could see into the wound, and that meant being able to progress more quickly, him watching the vessels and me doing the disc removal. I think had we used a microscope for this case, a conventional scope, the distance between the scope and the wound would have been too short to place instruments into the wound. I think having the camera head well away from the wound with that long standoff allows the long instruments we use to access the wound without clashing with the scope.